Hi, it's Dr. Brian McDonough, and welcome to the Dr. Brian McDonough Show. I have a really special guest today. His name is Jack Lynch. Jack, for 20 years, served as president and CEO at Mainline Health. Now, we have people from all over the country watching this, but Mainline Health is a leading health organization in the Philadelphia market. Philadelphia, New Jersey, Delaware has done some incredible things as an organization. But I'm here to talk with Jack about his years of experience, leadership, and the fact that he also has a view of the future, like we often talk about. Jack Lynch recently retired. He said that his father worked till he was 86. He was not going to work till he was 86. He retired at 65, and so this is new for him. Let me start, first of all, welcome you to the program.
Thanks, Brian. It's great to be on. I've followed you for a long time, and you do great work, and you educate consumers about some of the challenges that they're going to face in healthcare, but you also give people real insight to how to navigate the U.S. healthcare system. And for that, I applaud you.
Well, thank you. I really appreciate that coming from you. Where do you see where we are right now? It seems like a challenging time.
Yeah, as I was reflecting in preparation of our conversation, my own professional career, I spent 40 years in healthcare administration. Started out as an EMT, so I saw a little bit of the clinical side, but I've come to conclude that healthcare is as essential as any utility that we have: water, gas, electric, but we don't treat it that way. Most people have access to water, gas, and electric. Not everybody has access to healthcare and high quality, safe, and equitable and affordable healthcare. And that's where I think we've got a breakdown right now. How do we ensure that everybody that needs access to care can get access to, again, safe, high quality, equitable, and affordable healthcare?
I was reading some of your final comments. Obviously, with someone like you retires, lots of articles out there, so it was really easy to read about what your thoughts were and things. And one of the things you mentioned in your hospital system, I believe you said you had 55% Medicare, 10% Medicaid. So you're talking about more than two-thirds of people in one of those two groups. And yet the reimbursements seem to be less and less each and every year. How do you even run a business with margins like that?
At Mainline Health, as you described, 55% was Medicare and 10% was Medicaid, so 65% government pay. Medicare pays somewhere between 75 to 80 cents on a dollar of cost, and Medicaid probably pays 65 cents per dollar of cost. So how did a place like Mainline Healthcare make money? Well, for years, we made money because we made more money than it cost to provide commercial patients care. So in essence, commercial payers and self-insured employers who paid for health insurance and health coverage for their employees subsidized the underfunding by government. During COVID, we saw a dramatic increase in labor costs, supply cost, pharmaceutical cost, and most of us thought those cost increases were going to be temporary. They weren't. They stuck around. And that's where I think we went from, doing okay to really going forward struggling. You weren't paid in your practice to provide preventive care for the most part. You were reimbursed to provide sick care. And the more reimbursement tightens and the more cost pressure that practice, the more time is spent on taking care of sick patients and less time preventing illness. And I think it's a slippery slope. The more time we spend taking care of somebody that's sick, and the less time and resources we can put towards preventing people from getting sick, it just makes the situation worse. And when you think about it, even from an employer standpoint and or an insurer standpoint, when you invest in wellness or you invest in prevention, it can take 10, 15, 20 years for that investment to pay off. Most people don't stay with their employer that long, and most people aren't with the same insurance company that long. And so there's a disincentive to be spending money on prevention when, in fact, in the long run, that's what will save us money and improve health. The whole equity of care issue, it's just unacceptable to me that we've got infant mortality rates where Black infants are dying 2 times the rate of whites. Life expectancy gaps by race and zip code, chronic disease management, mental health and substance use care differences, cancer outcomes. rural versus urban access. These are all things that fall under the equitable care issue. And yet we've got a government that doesn't think there's an equity of care problem. In fact, you're being penalized if you've got programs dedicated towards some of those patient populations. I think that we've got to figure out how to take advantage of technology. I'm excited about what AI may mean to the future of healthcare, but we're in that space where I don't know that we're all confident that AI can do it by itself. And so it's going to need to be a combination of AI and human beings. And when you think about the concept of moving from one way of doing things to a completely different way of doing things, and then there's that in-between period of time, I think we're in that in-between period of time. We've got a failure by the Department of Health and Human Services around many things, not the least of which is vaccine guidance, but funding for research and education in healthcare. We've moved to a point where you can't trust what's coming out of the Department of Health and Human Services. It's been too politicized. You can't talk about healthcare without talking about how do we support the mental health needs in our communities. We did a community needs assessment for many years at Mainline Health, and every year it came out and said there's a mental health crisis. And finally, Mainline Health and the board decided to make an investment, a very large investment, and double the size of inpatient behavioral health beds. But again, those programs are not sustainable without financial support. One of the reasons it's so difficult to get access to a mental health care provider is because the reimbursement is low for those providers. And so when you come out of school with the debt that many of those individuals come out of school with, that's not the first place you go thinking that you can pay that debt back. So I didn't answer your question, Brian, because I don't have an answer, but I'm optimistic that we've got really smart people in our field dedicated to improving the safety, quality, equity, and affordability of healthcare. And you and I need to count on that because we're going to be the ones that are using healthcare going forward.
Anything I didn't ask you that you wanted to bring up? We talked about a lot, but anything that we didn't touch on you think is important at this point?
You know, Brian, we talked a lot about, industries and changes. This field, healthcare, is never going to be just about computers and chat GPT and robots. It's going to be about people. I often say friends and neighbors caring for friends and neighbors. And we've got to figure out how we maintain the personalness or the personality of providing healthcare so that it feels personal. And the challenges that we face as human beings to make sure that when we go see a healthcare provider, one, we know how to access one. And that when we get there, we feel listened to, we feel heard, we feel respected, and we in turn show respect and follow through and be a part of that care team, because we can't just rely on the care providers to improve our health status. We've got to be a part of that change. And until America accepts the responsibility that we can impact our own health, we're going to continue to have challenges.
Jack Lynch, I want to thank you for joining me on the Dr. Brian McDonough Show. I always enjoy speaking with you, always have, and I appreciate the fact that we got to share your views with a lot of people who maybe haven't had a chance to hear what you had to say about things. Thank you so much for taking the time.
Well, thank you, Brian, and keep up the great work. You're a great communicator, and you've got a great network to communicate messages on important topics. And I hope this one resonates with a lot of people.